Welcome to the MD Edge Daily News for Friday, July 6th. I'm Nick Andrews.
And I'm Mary Ellen Schneider. Today, an oral antiviral agent for smallpox shows efficacy in animals and safety in humans.
And later, low platelets are linked to complications in pregnancy.
Plus, a look at emerging treatment options in obstructive sleep apnea.
But we begin with new evidence that HPV testing is outperforming cytology in the early detection of cervical precancers. Women who received only a primary HPV test were 58% less likely to develop grade 3 or worse cervical intraepithelial neoplasia by 48 months than women who had the traditional Pap cytology screen. This is according to research published in JAMA. The researchers report that the primary HPV test also reduced the 2-year risk of cervical neoplasia compared with Pap smear alone. The HPV focal trial included more than 19,000 Canadian women between the ages of 25 and 65 years who received either Pap liquid-based cytology or primary HPV testing. The intervention group had cervical cancer screening with a high-risk HPV DNA test that detects 13 different types. If either test was positive, the patients were referred to colposcopy. If tests were negative, the patients returned to their final screen with both tests at 48 months. In the first round of screening, HPV testing detected significantly more cases of grade 3 or worse cervical neoplasia compared with the liquid-based cytology. At 48 months, the rate of cervical neoplasia was significantly lower in the HPV test group than in the Pap test group. But overall, the two methods detected about the same number of cases by 48 months. Dr. Gina Ogilvie is a researcher at the University of British Columbia in Vancouver. Dr. Ogilvie says the study also showed that cumulative rates of colposcopy referral were similar by the end of the study. That means that one of the concerns about HPV-only testing, that it would lead to overdiagnosis and more follow-up procedures, didn't come to pass.
The oral antiviral agent tecovirimat is being advanced as a treatment for smallpox based on recently reported studies that show efficacy data in animals and safety and pharmacokinetic data in humans. This is according to research published in the New England Journal of Medicine. Tecovirimat inhibits the protein p37 that is present in all orthopoxviruses to prevent the formation and egress of enveloped virons. Since it would be unethical to intentionally expose humans to variola virus, tecovirimat is being developed in line with the FDA animal efficacy rule. The rule gives the agency the authority to approve drugs based on animal data for diseases that have a low or non-existent rate of natural occurrence. This pathway was first used in 2012 to approve a treatment for inhalation anthrax. Tecovirimat has demonstrated protective efficacy in pilot studies conducted in rabbits infected with rabbit pox virus and non-human primates infected with monkeypox virus. In non-human primate studies, some doses provided nearly full protection from death, with a survival rate of approximately 95% versus 5% for placebo. It also reduced lesion counts and viral loads. In a tecovirimat clinical trial, 452 human volunteers were randomized to receive the antiviral agent twice daily at 600 milligrams, or a matching placebo, for 14 days. Adverse events occurred in less than 38% of patients who received the antiviral, compared with 1/3 of patients who received placebo. Events grade 3 or higher were experienced by about 1% of patients in both groups. The FDA is expected to make a decision on the drug application in August.
New research finds that platelet counts decline significantly during pregnancy, and low platelets are more common among women with pregnancy complications. The findings were published in the New England Journal of Medicine. Researchers compared outcomes for pregnant women who delivered at a single site in Oklahoma between 2011 and 2014. Pregnancy complications in the study included a diagnosis of hypertension, diabetes, eclampsia or preeclampsia, or abnormal placentation. About 4,500 women had uncomplicated pregnancies, while about 2,500 women had complications. When the investigators looked at average platelet counts by trimester, they saw no difference between those with uncomplicated and complicated pregnancies until the third trimester. At that time, mean platelet counts decreased at a greater rate among women with pregnancy-related complications. In fact, about 12% of women with complicated pregnancies had platelet counts below 150,000, compared to about 10% of women without complications. Jessica Reese is a researcher with the University of Oklahoma. She says that these data suggest that for women with an uncomplicated pregnancy who have a platelet count of less than 100,000, a cause of thrombocytopenia other than the pregnancy itself should be considered.
Continuous positive airway pressure may be the gold standard in the treatment of obstructive sleep apnea, but maybe not for long. In a series of presentations at the annual Associated Professional Sleep Societies in Baltimore, researchers presented 4 of the most promising new technologies. The nasopharyngeal airway stent is a single-use disposable insert with a flexible, semi-rigid silicone tube coated with a gel. The patient inserts the distal end of the tube into the nostril, and it positions itself to open the airway. A clip attaches to the exterior septum to keep the device in place, and the patient removes the device in the morning. A device providing continuous negative external pressure, known as CNEP, uses a silicone collar covering the front of the throat and a pump that applies suction to keep the airway open from the outside. The device is small and portable, but has shown some skin irritation and a choking sensation if not properly placed. Researchers are also testing an artificial intelligence platform to find the best candidates for oral appliance therapy. The AI platform has a feedback-controlled mandibular positioner using temporary dental trays to create impressions for the mouthpiece that the patient uses during sleep. The mouthpiece then connects to a remote-controlled device that makes real-time adjustments in the mandibular position without waking the patient. Finally, upper airway stimulation uses an impulse generator similar to a pacemaker. The upper airway stimulation system incorporates a sensing lead that is implanted between the intercostal muscles and attached to the impulse generator. The patient uses a remote control to turn the device on at night and off in the morning. And that concludes the MD Edge Daily News for the first Friday of July. Links to these stories can be found in the podcast description. For MD Edge, I'm Mary Ellen Schneider.
And I'm Nick Andrews. You can catch up on this week's news by listening to previous editions of the Daily News. Subscribe today, wherever podcasts are found.